They're changing a lot of things, changing Facebook. Now they're changing YouTube. And when you start a webcast, it's nice to know this ahead of time, but I don't. Okay, just give me a second. I gotta put the code in there, the right spot. So we put it on the front page of Neurosurgical TV. Okay, there's one more thing. Okay, we've got it. Okay, now it's connected. Okay, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Good morning. This is Dr. John Bennett of Neurosurgical TV, broadcasting from Miami Beach. We don't have the beach today. We have more of a computer theme in honor of Bushan. And we have a good group of panelists here. That's great. Okay, I'd like to welcome you to the broadcast of use of Chat GTB for the neurosurgery community, done by Bushan Thambri. He's a neurosurgeon from Mumbai. He's also a developer, which is a nice combination to have in these days of importance of AI. And Bushan did a series of 3. I put a link in the body if you want to look at that series of 3. And today, Bashan is going to talk, as I mentioned, about ChatGPT. Welcome, Bashan. It's all yours.
Yeah. Thank you, Professor John. I will start sharing now and start the presentation.
Okay. Can you just first go over a little bit about how you got into it? Maybe you had that planned anyways.
Okay.
Yeah. Because it's an unusual thing I've only run across one of the neurosurgeons that's a developer.
Right. So I hope you are seeing these slides now.
Yeah, perfect.
Yeah. So today we will be discussing a topic of using ChatGPT as a research tool for neurosurgeon. But these tools can be used by any researcher as such. How to evaluate things during research and all that, we will come across them. I myself is Dr. Bhushan Thomre. I am a neurosurgeon. I have been doing AI programming since more than 7 years now. Previously, we did 3 lectures on AI in neurosurgery, which you can see on the link as Professor told before. So without ado, we will move forward. So introduction. So first of all, we should understand what actually is ChatGPT. So ChatGPT is a LLM which is developed by OpenAI. LLM stands for large language model. So what does large language model means? It means, as you have seen in our last lectures, there is an architecture on which it is built, like there is some input and there is output. So for this text-based model called as an NLP model, natural language processing models, the input is the text and output is also the text. As we have seen in the previous models, we have used and developed one model where the input was some kind of parameters and outputs were some kind of numerical parameters. But here the input is the text in a natural language and the output is also a text in the natural language. So what does this LLM actually do? It is just a continuation of what you have done. Like uh, how it is trained. Like there will be a data, like if there is a story, like my name is Bhushan Thomre, I'm a neurosurgeon, dash, dash, dash. So the input will be this first three lines and the output expected will be like something, whatever randomly generated and expected from those models. So these are called as a large language models. It is developed by a very famous company now called as an OpenAI. It is a for-profit company now. Previously, it was an open source company. It is based in San Francisco, and it has a very famous CEO called named Sam Altman. They have developed another very interesting products beside ChatGPT like DALI, which is useful for text to image models. Like you give a text and it give you the images. Similarly, recently it has published a model named as a Sora, which is a text to video model. You give it some description like a moving train and some person is watching outside and it will give you an output in the form of a video. So those are some interesting models which has came out from this OpenAI company. Particularly, what does this GPT stands for in this chat GPT? GPT stands for generative pre-trained models. So these are the transformer models which have a different architecture than which we have seen before, and they are much more complicated than the simple step-by-step model. They are a combination of multiple models which are able to train and give you a much superior output. GPT itself currently is in stage 4, that is a GPT-4, on which the recent chat GPT is based on. The previous famous, what made GPT famous is GPT Model 3, which was based on around 175 billion parameters. As we have seen that image model, what we trained in our last lecture was based on just 2 to 3 million parameters, but this is based on 175 billion parameters, and that just GPT-3. Although for GPT-3, 4 newer models, we don't know what is the token count or parameter counts. It is estimated that it is around 7.76 trillion parameters, and that's huge model. We cannot run these models on our local system as we have previously run. It needs a huge amount of TPU and GPU powers on which these models are run. That's why we are not able to run these models on our system. And they are huge in size, like in terms of 175 GB and all above. It is estimated to be around 500 GB. And GPT-3 and GPT-4 is estimated to be around in TBs of data. So we cannot run these models on our system. So that's the introduction. Now we will go and see some of the anatomy. Everybody who has heard about ChatGPT might have used the system and visited this page. But for just completion's sake, I will say we visit things. The website is chat.openai.com. You have to register and get inside. Here you can see there you can produce different charts where you can enter some of the thinkings and talk it like a person with these GPT models. They are trained. These completion models are being trained on instruction-based models. So these models particularly are good in interacting with humans. So these interactions can be started like any WhatsApp chat by entering your text here. We will go further around that. The one important things about this is that although we spend a lot of time on exploring these things, there is something new came up in the last 6 months called as a GPTs. These are the other filtered and other separate and specialized models in which the GPT itself is trained on very specialized matters. Like as you can see on here, there is a tab, small tab called as the Explore GPTs. You need a $20 subscription for getting this, but the benefits you get from it are very beyond those $20. So once you press that GPTs, there will come different kinds of GPTs which are trained on these chat GPT models. They are interactive, but they have a specific built-in knowledge, like this a specific DALI, which is able to turn your text into images. This is the data analyst, where you can put a statistical query and give you the writing, and like a coloring mods, writing, logo creator, everything you can do it here. There are different kinds of GPTs like writing, productivity, research analysis, programming, education, lifestyle. We will see few of the GPTs today. And one of the GPTs which I have developed myself, which is listed on this store, that also I will discuss today. So moving forward, what are the various scenarios where we can use this chat GPT and GPTs, and how we can use it? Today lecture will be going to be a little bit on the textual side. I will teach you how to ask a proper question, that are called as a prompt engineering. Because if your prompts are not correct, the output what you get might not be what you have expected. The few general scenarios which to be kept in mind while interacting with GPT is like treat it like you are speaking with another person who is an expert in something. And you can even give them a prompt like you are an expert in, say, marine biology. And then you can keep on asking him some complicated questions about marine biology. So that kind of prompts really helps. These and other prompts we will learn today. So the first section, we will learn about how we can use ChatGPT while brainstorming ideas for your studies. Like you had some clinical, you're planning to start your clinical research in some way, and you want to have some ideas, and you want to discuss and explore some of the ideas in which you can work on. So we can go here in this prompt section and start typing our queries. Like I'm a neurosurgeon and I want to conduct a study in the area of, let's say, glioma. And then we ask him, can you suggest any new topics on which I can work on? So it will give you some output in terms. You should be aware, like this 3.5 GPT and 4 GPT are very contextually aware. What does that actually means is that it understands what you are speaking to, and it is very ingenuitive. Like it cannot guess what's going on your mind till you actually tell it. So your prompt should be very good. As you can see, it has suggested me very nice topics from the radiation therapy optimization, tumor microenvironment, any personalized medicine or genomic profiling in gliomas, psychological impact, resection techniques, and surgical innovations in this glioma studies. Or we can simply take a combination therapy, like what are the effect of surgery, chemotherapy, radiotherapy on this glioma. So let's say I am interested in this parameter, and then I ask him like, how can I proceed about it? By entering another query. So I go in and ask, and I want to focus my research on the effects of chemoradiotherapy in high-grade glioma. And can you suggest me some study titles and give me some summary of it? So it goes ahead and gives me some study titles which I can work on in these studies, like efficacy and safety of combined chemoradiotherapy, long-term outcomes of adjuvant chemotherapy, radiotherapy, individual treatment-based approaches for radiation sensitizing agents, predictors of the tumor, and you should like be appreciative of it, like what it is giving you. It is just giving you some ideas on which you can work on. You can modify this title, you can add, or after choosing something, you can do something about it, ask him to go into details and modify it accordingly. So you just have to keep talking to it till you get an idea about what research actually you want to do. So let's say I want to have to do some study further, and I choose the topic number 10. Now the interesting thing starts. Like, I can ask him to design a study for me based on this title itself. That's all. Like, it is a retrospective study, and I ask him how I can study this design a study for me, and it will give me a study design. Like, as you can see, it has given me that it is a retrospective cohort study. The study population should be a high-grade glioma who has undergone combined chemotherapy and radiotherapy as a part of their treatment regime. It has given me inclusion criteria. It should be glioblastoma or anaplastic or anaplastic oligodendroglioma, which is definition for high-grade gliomas, grade 3 and 4. Patient who has received combined chemotherapy or otherwise like that. And it has also given me parameters like how I should collect the data. The KPS score should be there and all. And it's like really amazing what you can do with this. So as you can see, it has given me outcomes like survival outcomes, progression-free survival, and all it has came of its own. It's amazing like how you can design a study in such a short time. While it would have taken us like days together or months together to design such a study. So moving forward, it has also given us what statistical analysis we should do on what type of parameters. We can go into details in each of this section, but due to time constraint, we won't go. But we can definitely have a discussion on it. It has given us the limitations, what are the future implications, and how we can publish the studies. Now we can, one part I want to tell you because it might not come into our mind. Like, I can ask him to prepare a master chart for me while doing that study. Hello. Hello, Professor John. Hello.
Yes, I'm sorry. Yes,
Yeah, you're able to see, right?
yes.
Yeah, okay. I will move forward. So I can ask him to prepare a dummy table for me, like in as we prepare in the Excel sheet, which we need to be submitted for the ethics committee. And just like that, it prepares a table for me, like what parameters it should include in your study. As I can see, it has given me what are the parameters, like it should have patient ID, age, gender, histological subtype, as it is a retrospective study, KPS score, comorbidities, types, chemotherapy doses used, radiotherapy doses used, radiation fractionation, whether used or not, what is concurrent chemotherapy given, whether chemo administered concurrent radiotherapy or not, what any sensitizing agent, hematological toxicity, any experience, or any gastrointestinal toxicity experience. Like that, all parameters.
Whoop. Okay, I think we lost the connection. He'll be coming back shortly. Good day, Ahmad. Are you there? Yeah, Bashan looks like he lost the internet connection. I'm sure it's just temporary. And he'll be fighting to get back in here. Just hang on. Lashawn should be back momentarily. You know, I really wish I could watch this webcast. I'm just busy doing other things like promoting, letting people know about it. And I would like to enjoy this. Well, I guess I'll watch it after it's all being recorded. I I can guarantee he'll be back. All your money's back. What do you say to that? Double your money back. Keep my fingers crossed. All right, are you coming back in?
Disconnected. I have been presenting the whole time.
Oh, no, you were disconnected. Yeah, I'll show you the last part you're in, so please come in again, okay? Oh, there you are, okay.
Sorry about that. Presenting the
Okay,
whole
let me, uh, okay, you want me to go back to the tape to find out where you stopped?
Yeah, sure. So,
You
was the
remember,
brain?
yeah, you were demonstrating that, the last we saw of you.
Here, okay. So, as you can see, I have asked him like about the previously we identified what part of the study you want to work in, and now it has given you some of the topics on which we can work on. I can ask him what are the various studies in high-grade glioma which you can read about. So sure enough, it gives you some studies in chemoradiotherapy related topics, which you should read, like what are the effect of high-grade glioma, where it is effective, where it is not effective. And as you can see, there are the links associated with this. So they are the references. If you click on it, it will give you a page on which you can go and read about the papers in more details. They have their own website about consensus where you can just pay and read those paper. No need to search on various journal website and all. That also you can do. So let's say if I am not satisfied with this kind of studies, I can just go ahead and ask it like, I am not satisfied and suggest me few studies in chemoradiotherapy in glioma and just give me the titles about it. And sure enough, it gives me that and along with some more titles. So here I identified few of the limitations of this literature reviews. It's not that quite extensive what you can expect from a AI agent. But I guess with more prompting and spending some more time, you can find out some of the studies which you could have missed just by doing a manual search on a PubMed. So here I have identified few studies related to the survival time and the impact of chemoradiotherapy on that. And it has given me some of the important studies in that, as you can see. And if you click on that link, it will take you to this page where some data and information about that paper is produced. So it is some interesting thing. I might not want to read all of these things, which might not be relevant for me. So I can just go copy paste this thing, go back to the ChatGPT and paste it and ask him to summarize this for me. So it tells me that this study is investigated the impact of delaying chemotherapy initiation on survival in newly diagnosed glioblastoma patients. And analyzing data from cancer genome atlas, results indicated that modest delay in starting treatment, like 27 days, did not worsen the overall survival of progression-free survival. So up to 6 weeks, it has says that you can start chemotherapy. So these are some insights which are easily obtained just by asking it to summarize the results, and you need not go through all this reading by your own. So after literature review, there is some another important steps now which can come. Like contextual PDF search. Let's say I have identified one of the paper which I want to analyze properly and contextually search it. What does actually contextual search means? It's like speaking to an expert. Like you have given, somebody has read that paper and you are speaking to it in a intelligent way, not just in a search way. Like if you are searching a PDF, you might enter some words like like survival, and then it will give you 10 words where the survival is given, and you have to read by yourself where the survival is there. But with this contextual says, you can directly ask him a few things like what is the survival. So it knows contextually what actually is entered in that PDF. So this is one of the landmark paper in glioblastoma by Rochester, where he has analyzed the effect of radiotherapy and adjuvant temozolomide on glioblastoma. This is an open source paper and we can use it for our analysis here. So this is a long studies and I might not have a time to go through such kind of paper, or I might not be well enough trained to read such a complicated paper. So what I can do as a solution. So if we go to ChatGPT, I have now entered into a GPT-4. Currently till now we were working in GPT 3.5. So here we can enter and add an attachment to a web PDF which we have downloaded, and it is now aware about that text by some ways which called as a retrieval generative system. I won't go into details of that. So now I can ask him some questions about like, can you summarize the main results and conclusion from this study? It is doing a lot of things in the background which you are not aware of. And beautifully, it gives you a summary of what are the results. Like the median survival was 14.6 months with temozolomide plus radiotherapy compared to 12.1 months with radiotherapy alone. It has given you a hazard ratio of 0.63, indicating a 37% relative reduction in the risk of the death, like that. So I need not read a whole paper to get the outer summary of that, not even abstract, which sometimes might be incomplete or they might not be that intuitive to understand the results. Now, this has published a very important protocol called as a STUP protocol STUP protocol in a glioblastoma with a temozolomide. Now we can analyze this also with this prompt. Like, can you summarize the flow chart of the protocol used in methodology in this study? And it has given me like what methodology is used, like what is the eligibility used, like 18 to 70 years, what are the exclusion criteria, like what we have done before for our studies. It has given what is done in this study in an organized manner. What the treatment protocol was used, like two-way fraction, total of 60 days for a 6 weeks period of time. Reading this and understanding and getting this insight would have taken you at least a couple of hours from this complicated paper. It has given you how they have done the follow-ups and all. I have also asked him to create an image of this flowchart. So currently it's creating an image for that. And as you can see, this image is not up to the mark. So these are some of the limitations in this. Like till now, that this image is produced by DALI. It has understood the context. As you can see, there is some randomization, some radiotherapy treatment protocol. It has taken some few basic concepts, but it's not able to join that in the form of an image. So we can make things simpler for it. Rather than creating an image, I can tell him to create an ASCII chart for that. It is one of the important prompts which you can use if you are in such a dilemma. The ASCII characters are basic ABCD characters in terms of English language, what a computer can understand, where A is translated into some kind of a binary code. So I have told him not to use DALI and give me in form of an ASCII. So now it has produced a beautiful chart for me. This can be a Prisma chart also for your randomized studies. And you can see like it has given me like eligibility criteria, WHO performer status, what is exclusion criteria. Then the randomization is done and stratification is done. So in the control group, only radiotherapy is used. In the randomized arm, radiotherapy with chemotherapy. What adjuvants are given, how they are given, and what follow-ups are done. So making this chart, understanding this kind of reading from a single paper might take a lot of time, and this kind of contextual search can save you a lot of time. So finally, I can just simply ask him if I want to cite this paper and I want to summarize some of the results from this study, which are only important results, and I want to present it in form of a table. I can ask him to do it, like summarize the main results in the form of a table. And it will give you a beautiful table where The median survival rate in terms of months is mentioned like 12.1, 14.6. Overall survival for 6 months, 84 versus 86. Overall survival at 12 months, and so on. Progression-free survival. It is one of the very good and landmark paper, as everybody knows. But I am taking it as an example only. You can read and search about any paper, and most importantly, you need not identify only a single paper. You can attach a 2, 3, 4 PDFs to it, and it will be able to combine the data from these 2, 3 studies together to give you the result. So that's something very amazing what these GPTs can do. So now moving forward, this is one of the GPTs which I have made. It is a clinical trial navigator. Its main focus is giving you information about randomized controlled trial and clinical trials which are registered with CDCs and other platforms, other clinical trials. And I can ask him like, can you find me some recent trials in glioblastoma? This is available on GPT, ChatGPT platform for anybody to use. So as you can see, it goes forward, search all over the internet, identifies a few studies which might be relevant in this context. And I did some of the recent studies, like this INSIGHT trial, this use of ultrasound technology to deliver chemotherapy. These are the real trials which are currently undergoing, which has been identified by this platform. So it has given me something like ultrasound technology, delivery in chemotherapy, immunotherapy studies, oncolytic immunocavitation trial, activation trial, sorry, autologous tumor lysate. And it keeps on going. Like these are some of the recent trials which have been published. And by clicking on these links, I can go ahead and get some more information if I want to read. Like say on this ultrasound trial, I want to have some more information. It goes to a page and gives you more information about that. Like these are the ultrasound probes, what they have used to induce cavitation and all. So this is an amazing thing, I guess, what we can do, which previously would have taken a lot of search and Google search and spend a lot of time to reach this conclusion. So the next thing is like we can use it as a medical translator. Many times we are not able to read what is published in other languages which you are not aware of. Like in for me, it might be French, Chinese literature, or Korean literature. So I can just copy and paste it here, and it will translate it for me. Or I can have something like I want to communicate with the patients across the world due to this globalization, and I can ask him to translate and communicate back and forth with my patients. The main thing about this is like it knows about the medical terms. If we try to do that just in Google Translate, sometimes medical terms are not well understood. But this GPT, Medical Translate, can understand those medical terms and will accurately transform into another language for you. Like as I have asked him to translate in French. I don't know whether it's correct or not, but I will trust it for now. And for some measures, if your patient just understand Latin, that also you can do. Just for fun, I'm doing this. So as you can see, it can understand ancient languages like Latin also. So moving forward, we can use it as a medical writer. It is one of the ethical things which you should use only with a scope of ethics in your face, because you can readily and very easily misuse this kind of things. Like you can use it to write or review the papers which are not ethically right to do. But there are some of the ethical things which are useful if you want to do with these things. Like this medical writer, it is another GPT which has another 400 million papers from PubMed, Nature, Archives, which you can search, like as we have done with consensus. But there is some beautiful things which you can do with these things. Like I can ask him to make a particular information pamphlet for my patient who is suffering for glioblastoma. I may not have a time to generate a personalized pro forma or pamphlet for each of the patient during our busy work, and we can just simply fill in some of the details, like this patient is this, his age is that, it is suffering from high-grade glioblastoma, and just produce some 300 words of information pamphlet for the relatives and patient to read. And sure, it will go ahead and analyze some of the studies, papers, and will give you those information pamphlets which can be distributed to the patient. As you can see, it has given the title like Understanding Glioblastoma. If you have you or your loved one has been diagnosed with glioblastoma, understanding the disease, its symptoms, and potential treatment is crucial. Glioblastoma tumors are safe. Our tumors are known for their rapid growth and resistance to conventional therapies. Like that, what are the treatment options which can be available? It has given few of the references which anybody can read. And what are the various innovative immunotherapy and gene therapy which have been done or explored. You can definitely modify it according to your setup, where some things are available, some things are not available. You can add those or ask him to subtract those kind of information, add those kind of information. Like if you have a bone marrow transplant, you can ask him to add that for blood cancers and all. And it will give you reference for this information too. So this is one of the very ethical and personalized writer for you, which you can use. And definitely you can use it for non-English writers. You can use it to modify your language or correct your grammar. The next and the last thing will be like you can use it as a medical illustrator. Although it's not that perfect, but with some prompt engineering and having like 10 to 15 attempts, you can get some kind of image. Like this is a beautiful image created by it, where the skull is shown and a tumor is shown. Although I have asked it to produce a tumor in the frontal lobe, it has given me an image with a tumor in the frontal and temporal part, basically. So it's not perfect, but you can ask him to draw diagrams based on images. So in summary, as you have seen, there are multiple ways which you can use, like from beginning of a study, like brainstorming ideas, finding references for your studies, doing some kind of statistics. This statistics part is a whole game altogether. It will take a whole lecture if somebody is interested. Then we can use it as a medical translator, medical illustrator, a writer, and getting information within the PDF or contextual search. So these are all things we can do with the ChatGPT as a research tool. There are many aspects which I have not touched today because I wanted to finish this within a half an hour, 40 minutes of time. And if there are any queries or critics, anything, we can discuss it further, as well as if somebody wants to contact me, this is my email. Anybody is welcome to discuss these things with me. I'm always very appreciative of anybody from speaking. Thank you. So if somebody has any question, please go ahead. You can type it in the chat or ask to Dr. John.
Yes, thank you very much, Bhushan. Again, I wish I could pay all my attention, but I was promoting it and making people not sure about it. But I have a question, because this is in the realm of computers, which, neurosurgery, I didn't train as a neurosurgeon, but I do know a bit about computers.
So your voice is breaking.
Oh, I'm sorry. Okay, can you hear now? Is this okay?
Yeah, it's clear. Yeah.
Okay, sorry about that. Now, suppose a neurosurgeon has a website and he wants to build a chat GTP for that website. Would you advise that for any neurosurgeon with a website or any type of internet property to have a GTP treatment of it, or?
Yeah, definitely. Like particularly in terms of websites like this Neurosurgical TV, you can feed all the informations, text information, make a GPT out of it, like I have done for clinical trials, and we can ask questions about like what topics on AI are discussed, what are the topics which were discussed, and it can communicate back and forth with you till you get an appropriate information out of that chat GPT. It will be a like talking to a person who is expert in your website.
Right.
So definitely that can be done.
Well, I think I'm going to consult you really, because I'm probably like a lot of people that want to improve their website, and any advantage like using this technology is welcome. So I'll be talking to you, and I'm sure you're going to leave your name and contact info for anybody out there that wants to kind of have you do some kind of consultation. The thing is, but as doctors, we don't want to sometimes ask anybody, we want to do it ourselves. But really, I think they could get a lot more done if they had someone guide them through. Neurosurgery is enough for you guys. I mean, really, that's plenty. That's plenty. I don't expect, them to stop their practice and have to learn programming and stuff like that. We'll tell you, honest. Anybody else?
I guess one question has came up on the chat. It's by Dr. Ahmed.
Oh, yeah. Okay.
He's from Afghanistan Neurosurgical Society. He has asked how to search CT scan and MRI on ChatGPT. Although this is like a multi-model technology, GPT itself, it is able to identify the images, it is able to identify the text, it is able to connect those ideas together and give you the results. The training of these GPT models are not particularly done on CT scans and MRI. So definitely you can modify those. There is something called as a fine tuning of the model, which is also a costly affair on itself. But you can do it on your laptop also by using their hardware. There is something called as an API by OpenAI for fine tuning. You can train GPT on those images, and you can feed it to that, and it will give you the expected output. The main part of such models is not just training part. The main part is developing the database itself. Like you should have an appropriate database of CT scans and MRI, and it should be labeled data. Like it should give you the results. Like if there is a scan with an EDH, the output, what you expect, like the EDH is in the right frontal area, it is of moderate size with a midline shift of less than 5 centimeter or greater than 5 centimeter. Such kind of hundreds and thousands of images or of MRI and CT should be labeled for generating a database. And then those database, which is of major efforts from your side, once that is done, then the rest of the part can be possible technologically. So that data you feed for the training, the ChatGPT fine-tuning model is created for you personally, which you will own, nobody else can use it. And then you can ask him to feed, giving the new CT scans or MRI, it will give you the results on that. So I guess that answers your question, Ahmed.
Perhaps he did. He must be in a place where he can't speak.
Yeah.
There you go. Okay, there you go. How you doing? Good.
Fine, thank you for your presentation, excellent presentation, and thank you for as answering my question. Uh, we are interested, and I would like to have a communication with you as well.
Sure, sir.
Yeah, I think you're going to be in demand, Jushan. You're going to be in demand for people, especially if they know you're available. Uh, I know a webcast like this won't generate the interest such as trauma or something like that. But there are segments that do want to know, and we just have to let them know. And it's great to have people like Ahmad who are curious, you know, from a country that doesn't have much state-of-the-art equipment. Yeah, that's another question. Could a country like an underdeveloped country benefit using ChatGTP?
Yeah, of course. Like this is one of the technology which doesn't have boundaries of any nation or any place. If you're just simple internet, ChatGPT is not banned by any major countries besides some bans in China. Almost everywhere it is open to use, and it is a one of the state of the art model which no other company even they have tried a lot, but they are not able to catch up to this awareness what ChatGPT 4 has achieved. And definitely, like you can segregate and modify those models according to your need. Like as I have done with that clinical trial, if like you can feed it your personalized data, let's say about your patients, and it can analyze whole of your hospital's history for you without taking any that retrospective study loses its meanings if you are able to do such kind of searches. Like I can feed my 10,000 patients which are operated, all of it in the raw data, and ask it to produce results for me for just vestibular schwannoma patients. And I can just ask a simple question to it and it will generate a data for me. So the basic need what we have used to publish previously, like retrospective studies used to be a huge deal, but now we can do that in just a few minutes or few hours of time by analyzing those kind of data. So definitely in every hospital from small to big, we can use it.
Well, you know, let me let Victor in. Let me admit Victor. He's a big. There he is. He's a big neurosurgeon from Mexico. He's waiting to get in here. Yeah, I was going to ask you. ChatGTP is free, correct? And I know there's a paying model. It's like $10 a month or.
No, it's not free.
Oh, it's not free. Okay.
Yeah. So currently,
Hello, how are you?
Oh, I'd like to meet Victor Hugo Perez, very big in the world of neuroanatomy from Mexico. Hi, Victor, welcome.
Hello, how are you? This is a very interesting program, very interesting planning to learn neurosurgery techniques and also anatomy and everything related with neurosurgery. Congratulations.
I'd like to ask a question, Bushan. Can you think of any applications between ChatGTP and neuroanatomy off the top of your head? Can you think of anything how it would benefit neuroanatomy now that Victor's here? A big mind of neuroanatomy from Mexico City.
It's nice to meet you, Professor. So definitely there are a lot of things you can do because anatomical knowledge is a vast thing, and you can go like you can zoom in, and it will never end till you reach histology and beyond also. So integrating that kind of knowledge in a contextual sense for one person, like you can be an expert in one part of the body, may not be in other. So that is one thing I can think about. Like it can read tens and thousands of books. We can train it on, and it will be able to generate results for you on that particular thing. Second, in a research perspective, we can ask him to generate, as I have shown in this presentation, the diagrammatic representation or illustrations can be drawn with such models. Like you can provide it some kind of images and ask it to label by itself. of course, it will need some kind of training, and just with a photo, if that training is done, any medical student can just take a photo and get a label diagram out of it, no matter from where it is, in the neck, dissection, in whatever plane it is, it will be able to generate those kind of labels. So these are some kind of projects I can think about in anatomy.
Let me
Yes,
ask a question. Let me ask. Go ahead, Victor. Go ahead.
nice to meet you too, dear friend. Yes, I think we can work with you in this chat, and it sounds very, very interesting and useful for all the neurosurgeons around the world, especially for residents. You know, neuroanatomy is not going to pass away. Never, never, never. Anatomy is going to be in the earth for every time, for all the time.
You know, Victor, I think that there are tools being created now that'll even make neuroanatomy more easily accessible, because Bushan, isn't GTP good with fixed data sets, correct?
Yes.
Yeah, and in
I did not get the
neuroanatomy is
question. What do you
essentially
mean?
neuroanatomy is a fixed data set,
Oh,
right?
yeah. Yeah, correct. Like, but with this kind of newer technologies, as I have shown today, GPTs, you can easily feed newer data to it. Like, I can just attach a new book, like if some new Harrison's is coming up, although I should not do that, but if some article is coming up, I can just feed that article if it is legally available in the original text, and I can get and extract the data from that. Like, addition of the data is no longer remains a problem in that. Although it has been trained till 2023, we can add data much recent, like last month also, but we have to do it manually. It won't be able to do it by itself.
Oh, that's a lot of work.
Yeah.
Well, I hope there's a lot of students that aren't too busy in Mexico. Well, we'll look into that, Victor. We'll definitely look into that. And things will be changing. You know, this is the best time in history to practice medicine, I think. I mean, in
Yes, I
history,
know.
oh, things are changing so much. In the next 5 years, I don't think we're going to recognize medicine in 5 years. So much has changed just in the last couple of years. So I
Yes,
look
yes.
forward to changes like this. So anyway, okay, Bushan, thank you very much. And we'll end today's broadcast. And we'll have to do more if you'd like to do more. And make sure you put your contact info up there on the screen so people know how to consult you, like I'm going to consult you, to say, how can you help my project, my website? I'm going to ask Bushan that.
Yeah, I have like entered in
Okay.
my
In the chat
email
on this.
and name into the chat.
Okay, very good. It's in the chat. That's very good. And we look forward to your next webcast. Thank you very much. And thanks, Victor, for coming by. Thanks, Ahmad. Thanks, Martin.
Bye bye.
Thank
Bye-bye.
you. Thank you very much. Thank you.
Okay, stop recording.